According to the American Cancer Society and Center for Disease Control, one of the most important things you can do to save your life and prevent premature death is undergoing a colorectal cancer screening. What is colorectal cancer screening? It's a type of health screening that detects colon cancer early by going through a very simple laboratory test. The lab test can be done by you taking the kit to your home and applying a sample of your feces or your stool. Or you can collect a sample of your stool, send it to the lab for them to analyze it for you. Not all blood in your feces can be detected. Some blood in your toilet or feces or stool could be hidden. And if you have colorectal cancer, it may be hidden, and by the time it's detected, it's too late. Therefore, when you're above the age of 45 and over, undergoing that colorectal cancer screening is very important because it has 90% survival rate. That means there's a 90% chance that if it's detected early, we could save your life. So hear me. Next time you go to see your primary care doctor and the topic of cancer screening doesn't even come up, please bring it up. Ask your doctor about when you are due for that cancer screening. What brings about colon cancer? It could be genetics. It could be environmental factors, including smoking, unhealthy lifestyle, such as sitting all the time and not exercising, having unhealthy dietary habits like eating too much fat, smoking cigarettes, not sleeping enough, not hydrating enough, putting your body into stress all the time. Excessive stress could bring a lot of physiological and psychiatric health, unfavorable health conditions to you that you cannot even imagine the extent of what excessive stress could damage your life. Therefore, if you are at the age of 45 and over, please ask for that colorectal cancer screening. American Cancer Society and Center for Disease Control is encouraging us to get screened. Even if we screen and there is nothing there, you have your health. You have a peace of mind because you're not going to be worrying about that. If you send your stool, your feces, or your toilet to the lab and they detect blood in it, and that blood is not from menstruation or hemorrhoids or because you ate something that was red in color, what they can do is to call you in for a follow-up colonoscopy. Colonoscopy is a healthcare procedure where they put an instrument through your anus into your colon to survey the area to figure out the source of the bleed. If they find any polyp, if they find any suspicious growth over there, they can then proceed to have surgery or cut it off so that your risk of having colorectal cancer is decreased. Do not take this for granted. If you are above the age of 45 and over, ask for colorectal cancer screening. It's very, very important. Like I said, not all blood in your stool, toilet, or feces, which is the same thing, could be detected by your naked eye. Some of them it has to be detected by a microscope, or it has to undergo a special test like a serum sample or something on your toilet to bring it out. Okay? So if you haven't heard anything at all, if you're listening to me and you're above the age of 45, please ask for colorectal cancer screening exam next time you visit your primary care doctor. You may be saving your life because it has 90% survival rate. Colorectal cancer may not give you any symptoms at all. However, if you have problems going to the bathroom, if you ease yourself and your toilet comes out like a pencil, know that something is obstructing the flow of that feces smoothly. So it should be a caution to follow up. But even if you don't have any symptoms at all, no pain, no constipation, nothing at all, please ask for colorectal cancer screening and thank me later. If you like this video, please like, subscribe, share freely, and follow me because me and you, we are in this life together. Thanks for watching.